Hello everybody and welcome back to another episode of My Beat Goes On. As always, my name is Chris and I'm going to be your host today. And I've been doing some episodes for a little while now, and I realized we haven't actually talked about the one thing we're talking about, which is the heart. I know a lot of us, we know the basics of it, but there's some other stuff, that we should know, and maybe there's some stuff that people don't know just because we haven't really taken the time to educate ourselves on the actual organ that we're talking about. So today, we're going to get to know our heart a little bit better, and hopefully this might help y'all when the doctor's talking about something, you'll know what they're actually talking about, because we all know that sometimes nurses and doctors, they think that we know more than we do, so sometimes they go a little bit faster paced than we're ready for. So hopefully this will help you keep up with them and get some basic knowledge on the actual organ that this channel is covering. So, the first thing we're going to talk about is, of course, the disclaimer. Don't want to do this, but, there's a lot of lawyers out there, so I am going to do it just because of those people. Just to say, there's no information given here that's going to be used for self-diagnosis. This information, it doesn't replace medical consultation with a qualified healthcare or medical professional to meet your needs or your loved one's medical needs. And to the best of my knowledge, and probably with this one, it's probably not going to change, but over time information does change, and it may no longer be accurate. So that's kind of up to you to keep up to date on that. If you're looking at this way later down the road, just double check some of the stuff if you're really concerned about it, make sure it's still accurate. And the video is meant to help you gain a basic knowledge of the information so that you can formulate useful questions to ask your nurse or doctor. So the first thing we're going to talk about is the chambers of the heart, which, if you didn't know, there's 4 chambers. You have the right atrium, the right ventricle, which is where unoxygenated blood comes into your heart to go to your lungs. After it goes to your lungs, comes back, goes into the left atrium, then the left ventricle, and from the left ventricle it gets pumped out through your aorta into the rest of your body. And as you can see in the picture, the wall of your heart down in the right and left ventricle, you can see how they're a lot thicker, which that's not a mistake. That's actually how it is, because those pump the most blood to the furthest distance. So that part of your heart actually needs to have a lot more muscle and be a lot stronger, because especially the left ventricle is sending all the blood through your entire body is being pushed by your left ventricle. So the wall down there needs to be pretty thick. The next thing that you should know is the flow of the blood through your heart. For this, the blue is unoxygenated blood, and the red symbolizes blood that has already gotten oxygen from the lungs. So here, I wrote that we start in the right atrium, which is where we do start from the heart, but all the blood from your body comes in, as you can see on the top there, the superior vena cava, and on the bottom, it's kind of cut off, but that up arrow is the inferior vena cava, which those pump all the blood from your body into the right atrium, which then it gets pumped from your right atrium through the tricuspid valve into your right ventricle. And as you can see right above where it's written tricuspid valve, it goes through the pulmonary valve into the pulmonary artery, which then goes to both of your lungs. And once it goes through your lungs and it swaps out carbon dioxide for oxygen, it comes back through the pulmonary veins on both sides, and that blood gets pushed into your left atrium, which comes down through the mitral valve into left ventricle, which then gets pumped through the aortic valve into the aorta and to the rest of your body. And then some of y'all that have valve problems or issues with bad valves or valve replacement, this will also kind of show you which valve they're talking about and where it's at. So this is pretty good stuff to know when they're talking about, especially like right heart catheter versus left heart catheter. If you know that they go into the right heart catheter and your oxygen level is like 70%, you know that this area here is unoxygenated blood, so it's going to be lower than, say, if they did a left-sided heart cath where you've already gotten oxygen in your blood. So a lot of this stuff, it seems kind of basic, but when you put it together with some of the tests and the lab work they do, this really does help you understand kind of why numbers are the way they are, and hopefully will help you not be as worried if you get a number that sounds like it's not right or sounds like it's a little on the low side or high side. This will kind of help you understand that, maybe it's supposed to be that way and it's okay. Another thing, conduction pathway of the heart, which is basically the heart's electrical system, which this will attribute for essentially any heart block you have, and it can help you understand where they come from and kind of how they happen. So everything with the heart starts at the sinoatrial node, which is usually just called the SA node, which is essentially the heart's pacemaker. This is set to start every single electrical beat, and it's based off of, I think it's actually oxygen demand. So, like when you're working out, you're walking, for some of us, just walking up a flight of stairs, we get winded, makes you tired, feel out of breath. That sends signals to this node to pump faster so that we can get more oxygen to our body quicker. So it starts there. It goes through the atriums, goes to the left and right, which should go about equal, and it goes through those until it hits the atrioventricle node, which you usually just hear it called the AV node. And right here, I think on the next slide we have the QRS complex, and we'll kind of go through where each one of these associates with that. So when you're looking at like your EKG, you kind of know what part of the electrical system you're looking at. But it gets to your AV node, and it actually pauses here for just a second, gives a chance for your atrium to kick all that blood into your ventricles. And when it goes through there, it goes down both the left bundle branch and the right bundle branch, which are associated with the ventricles that they're going to stimulate with their electricity. So when you hear about left bundle branch and right bundle branch block, they're actually talking about these two little electrical pathways. And then it goes through, and you can see all these little fine fibrous looking electrical pathways, the conduction pathways it's labeled here. These are actually called your Purkinje fibers, and they're the ones that cause a simultaneous beat of your ventricles so that all the blood gets kicked out at the same time, just like it's supposed to. So these Purkinje fibers, and you have some like that in your atrium, it's just not shown here. And those can actually be the ones in your atrium are actually the cause of like AFib. Those little fibers, they'll start firing instead of using the SA node. They'll start firing, causing the atrium to just start their electrical signal from all different places all over, which gives you no atrial beat, which is what gives you that kind of squiggly line instead of your nice P wave that you have. And on the bottom, those little Purkinje fibers, when they start firing, when they fire all over the place in different places, that's what actually gives you ventricular fibrillation, which is the same as the AFib, except it's in the bottom part. And that's, as we all know, that's not a good thing. That's where your ventricles don't actually beat. They don't actually beat, they just kind of flutter down on the bottom, and we get no blood to our body. And when you have VTach or ventricular tachycardia, that's when one of your Purkinje fibers, it's the same spot, actually produces that really fast pacing. So that's what causes the VTach as opposed to the VFib. The VFib is just electrical signals starting all over the ventricles, and the VTach is it's pretty much just in one specific spot. And there's different types of VTach, so we're not going to get in all that, but essentially the way it works is it's one spot. So just kind of so you know, if you have episodes of that, or if you have like PVCs, that's something that starts in the ventricle and like a random spot in your one of your Purkinje fibers. And that's also something where when people get ablations, they can find out which area of the heart's irritated, causing its own electrical signals. And that's when they actually go in there and just wipe that out, and it helps a lot of people. So that's kind of the stuff with the electrical part of the heart rate. And with the heart waves, or the heartbeat and the electrical system, we have the QRS complex, which is associated with the entire electrical system. The first part you're going to see on a normal EKG is the P wave, which that's associated with the contraction of your atrium. So that's when the blood's being squeezed out into the ventricles. It's just that little tiny wave, and that's all the amount of time it takes for that to happen. You have the PR interval, which is your short break from when the electrical signal gets to the AV node, and it sits there and it waits a second because it needs all that blood to actually finish getting into your ventricles to have a more effective heartbeat. And then the next is the QRS complex, which there's two things going on here. This is when the atrium are repolarizing, where when they squeeze, you have the bunch of electrolytes going back and forth. This is where they kind of change back to get ready for the next beat. And the QRS complex is also the contraction of your ventricles, which when you get the left or right bundle branch block and they're not beating simultaneously, this is where this gets a little bit longer because one side of the ventricle is delayed by a fraction of a second, causing the QRS complex to get wider than it normally would be. Next, we have the ST segment, which is really just kind of where your heart's taking a break. Nothing's going on here. And you have the T wave, which is where the ventricles are repolarizing. Electrolytes are going back to where they're supposed to be, getting ready for that next heartbeat. So this is the QRS complex. It looks kind of simple, but there's a lot going on, and each one of these only lasts, maybe a half second. And that's a lot of stuff that your heart's going through, and if you think about it, your heart's doing that every single beat, every single day for the rest of your life. And to me, that's pretty crazy when you think about it, because that's a lot of stuff going on. But it's pretty cool stuff too, and it's always good to know what you're looking at, because a lot of times you'll see your EKG, you have no clue what they're even talking about. So hopefully this will help you understand what's going on in that QRS complex, your electrical system, blood flow, all that stuff we've covered today. So that when your doctor's talking to you, it'll help you understand what they're talking about, and maybe you can formulate some good questions for them. The last thing, I think this is the last thing that we have. Now I'm drawing a blank, but last thing we have is our coronary arteries, which a lot of us, especially those with heart attacks, we know all about these, or at least we like to think we do. And me being one of those people, before looking this up, I didn't know everything about it. You hear about them, but you don't know where they go. And this is kind of a basic picture. Obviously, there's little vessels going all over the place in your heart supplying blood. But as you can see, you have your three main ones. You have your right coronary artery, you have your left anterior descending artery, which if you have a heart attack in that one, that's the one they call the widowmaker, because if you do survive that, or not if you do survive it, but it's one that's very difficult to survive because it supplies the left ventricle, and this one will kill you pretty quick. So if you had that and you survived it, you're probably pretty lucky, because that's one that most people, or it has a higher rate of killing people. Then you also have the left circumflex artery, which goes around to the back of the heart, the left ventricle, which, of course, some of these, they kind of go all over the place. It's definitely a lot more detailed than this picture, but just give you an idea. And I never thought about it until I saw this picture, but if you look at it, the arteries come straight off the aorta. So if you think about it, I always thought, how did they do these heart casts? Get this wire through all this stuff into those arteries. And when I looked at it, and I'm definitely not minimizing it, but it seems like it's a little bit easier than I originally thought, because it looks like when they do the catheter, they'll just go through one of your arteries, and they go just straight up into the aorta, and they're able to guide it through the opening into these coronary arteries to get to the blockage or wherever they need to go to do their stuff. Which definitely, I don't know how they do it. I'm sure there's videos out there, I just haven't watched them. I guess because it's too real for me and I don't really want to see that kind of stuff. But that's some pretty good skill, if you ask me, to be able to go through an artery and get all the way here and do whatever they have to do to unclog these arteries. So that being said, that's kind of your basic coronary artery situation. As you can see, you got the three, and they cover your entire heart. So if you got a problem with one, you've got problems. So It's always good just to keep up. That's why I say keep up with your appointments, because if one of these, something happens, you're in trouble. So just make sure you do what you got to do to take care of yourself, because, they get blocked off pretty easily with people that have heart disease. And the interior diameter is only about as thick as a coffee stir, which, if those of you that drink coffee, that little tiny straw they put in there, that's about how much room, when they're clean and open, blood has to go to supply oxygen and nutrients to your heart. So if you think about that, it's kind of amazing that, they don't just close up on everybody, because that's super small. But just to give you an idea, that's all you got supplying the blood to your heart. So now we have questions for your doctors. Now these are kind of basic. It's not really specific to any one medical thing. So I couldn't really think of too many great questions. Y'all might think of better ones. But stuff you can ask is if there's any abnormalities with your heart chambers, which people that have cardiomyopathy, they have enlarged hearts. Some people have enlarged left ventricles. They have the walls of their left ventricles are thinner, more stiff. So you can ask about that. You can ask about any abnormalities of your QRS complex. Ask them that and see what they show you. Make them teach you what it is. Don't just let them show you what it is. Make them teach you, because this is stuff you need to know, especially what if that person retires, or, what if you have to go somewhere else and you have to do your initial history and all that. You can go in there knowing what you're talking about. And I think that when you know what you're talking about, and I'm sure this isn't true for all doctors, but I think some doctors, when you know what you're talking about, it seems like they treat you with a little bit more respect than if you come in there just not knowing anything, which shouldn't be the case, and hopefully it's not for most of them. But I'm sure we all had our fair deal and run-in with, different nurses, doctors, that if you don't know what you're talking about, they kind of look at you and make you feel like you're stupid, which is not okay by any means. It's no reason you should have to know everything, but it's good to know it, just so that you can kind of come in there and hopefully with some of those rude people, they can treat you with a little bit more respect. Next, you can ask what you can do to fix or minimize the effects of any of these abnormalities. You can ask what arteries are affected by the coronary disease. You can ask which parts of the heart are affected by your issues with your coronary arteries, so you know which area may be receiving less blood flow. And then what aspects of your heart, as in the blood flow, electrical pathway, helping with the chambers beat better, which part does your medications affect? It's good to know, especially, I know if you're on metoprolol, that does blood pressure, but that also helps, and it's with any beta blocker, they generally help your heart beat stronger and a little bit more efficiently, which keeps your heart rate down. So if you don't know that, and your blood pressure is good, and you decide to skip your metoprolol or your beta blocker because you're like, my blood pressure is good, it could be affecting something else. So it's good to know what exactly your meds are for and everything that they're for, so that you can kind of make the informed decision if you can't take a med, or if, hopefully you're not in this situation, but you can't afford a medication, maybe which one is the most important to get, as opposed to which one you might be able to slide if you absolutely cannot afford it. So it's good stuff to know. And that is the end of this episode. I hope this was helpful. I hope y'all enjoyed it. It's definitely good to get to know your heart. If you want to know more about your heart and what everybody else has going on with their heart in the heart failure community, I would suggest finding us on Facebook. The link's going to be in the description, so make sure you check it out down there. We also have Instagram and Twitter, which I will admit that I'm absolutely terrible at getting on. I need to get better about that, but I don't know, I got a lot going on, and sometimes I don't think about it. So get on the Facebook group and yell at me for not upgrading and updating the Instagram and Twitter. And we also have our website, mybeatgoeson.org, which we do put a lot of information on there that's more useful than education, I'll say. We have lists of stuff that you should have ready to go to the hospital, and just stuff that's going to help you in general, rather than all these generic websites that just give you the same information over and over. We're actually trying to help you have a better life and be prepared for situations that are probably going to happen. Being honest, they're probably going to happen for some of us. So get on there, check that out. Make sure you like, share, subscribe, comment, all that good stuff. That'll help with the search capabilities on YouTube. It helps people find us so that they can get involved and they can come to our support group and we can all get together and talk. And that's just more people to give stories, to share information, what's worked, what hasn't. It really helps everybody out. So it only takes a second. You're already watching the video, so just go down there, even if it's just hit the like button. Just do it. It'll make it so that everybody can help find this. Hopefully we can take care of and, conquer this disease eventually. But the only way we can do that is if we get everybody on board. Also, we have a medical trials group, which if you want to look at trials, we have different technologies. We work with a few different companies. Come on, check that out as well. So that's going to wrap it up. Hopefully we'll see you next time. And until then, keep on fighting, and we'll see you later.